Austria's healthcare system. It is often labeled as free, but is it really free? How many people think it is? Well, hi, I'm Patrick. I'm your friendly immigration lawyer from Austria, and people often reach out to us and say, well, we have several reasons why we want to move to Austria. One among them is you have free healthcare. But is that really true? Let's dive into it. Austrians enjoy universal healthcare. That means irrespective of whether you're an employed person, a self-employed person, a student, a pensioner, a dependent of somebody with health insurance, you may be covered by Austrian health insurance. And because so many people are covered by it, there may be the perception that it is free, but it's not really free. And here's why. The Austrian social security system, so also healthcare, is mainly funded by contributions by all the people in Austria. So irrespective of whether you're a self-employed person, an employed person, a student, what have you, all of these people have to pay financial contributions to the pot from which then people can have their doctor's visits and other medical services paid. So it's not free because you've already paid into the pot. First off, the contributions that you pay can be quite hefty, and they're also dependent on how much income you have. So they will rise up until they hit a certain threshold. They will rise incrementally depending on your income. And we have to be honest, the greatest part of contributions are borne by people while they're being employed or self-employed. So irrespective of how often you go to the doctor yourself, if you feel like you yourself, you are a very healthy person, you feel like you don't ever have to go to doctors, well, you still have to pay into the general pot. Then the next thing is there are co-payments. So depending on which doctors, for instance, you want to go to, it's possible that, for instance, if they are outside of the network of the carrier, so maybe like a private doctor, you will have to pay a certain amount out of pocket on top of what you've already been paying as general contributions. So you see, you keep on paying for Austrian healthcare, irrespective of whether you personally use it and how often you use it or not. So these contributions can be very steep that you have to pay, but in general, the perception is still one where people say, well, I think at the end of the day, it's still worth it because the Austrian healthcare system is ranked among the best globally. So the actual services that you receive for the money that you pay into the system is top tier at the end of the day. So that's why people don't yet revolt on the streets. But still, if you were to come to Austria and say, well, it's perfect, I never have to pay for any doctor's visits, I don't have to pay for anything that I do at the hospital, you may be in for a little shock. So again, is Austria's healthcare system really free? No, it's not free. You could say it's a system of shared responsibility, but overall it works, and it works quite well.